Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and one of the MCs here at Gold Learning. Welcome if you're joining us here today. We're going to have a little bit of fun today and talk about one of our upcoming symposiums, our Tongue Tie Symposium. So popular, in demand, and still lots of information to share. And many of you, of course, have attended before and have thoroughly enjoyed it and felt that it's really taken their practice to a whole new level. Now, with that, it comes with still not enough research. We're still waiting for protocols. We're still, thinking about all the different cases that we've had in the past and, of course, the cases that we're going to be faced with in the future. And to help us with that, we have the delightful Melissa Cole here with us today. Welcome back, Melissa. It's so good to have you here today.
Oh, thank you for that warm welcome. I always love joining in and learning alongside everyone.
Yeah, absolutely. And that's what really the Tongue Tie Symposium is. It is 2 days of jam-packed content. So get ready. You've got to clear your schedules, get the crock-pot on, as I say, and all those special toys out for the kiddos if you happen to be at home. So we are going to be busy. We're going to get into some of that content today because Melissa's going to be sharing a little bit about what's going to be happening in her presentation. Now, Melissa, your presentation is Feeding is Movement Activities for Supporting Optimal Infant Oral Function. Tell me a little bit about what inspired you to sort of dive into this topic.
Absolutely. I think like most clinicians, when we encounter challenging cases, we always want to find, that next tool, that next technique that can really help us help our own patients and clients. And so, with feeding issues, we see so many variables and babies that are dealing with lots of issues. I felt like I needed more tools in my own toolbox. And so I have done lots of trainings and different learning along the way and sort of have extrapolated what's worked best and served me in my practice and have that to share with all of our gold delegates.
Well, that's fantastic because I think this is a common thread that we hear, what tools and what practices can I actually do? I feel like my toolbox is pretty empty. So tell me about the exercises and the techniques that you're presenting. How do they really differ from sort of the generalized frenectomy wound care?
That is such a good point. And I like for there to be a distinct difference between the two, because we can have some fun sort of play-based activities for oral facial development, which may or may not be part of a frenectomy care plan. So kids that are dealing with oral functional issues may or may not have tongue ties, but all tongue-tied babies usually have some aspect of oral dysfunction they need support around, but there's the actual wound care, meaning activities that are used to keep the wound healing in an optimal state. That is not part of this discussion. We're actually going to be talking about the activities we do to tone down what's too tight, strengthen up what's too weak, work on range of motion activities. So this is very different from actual wound care, and all babies might need different activities. Some need a few, some need a lot, but it is absolutely different from the actual wound care.
So this is really good. So I could actually take some of this and apply it to my other cases, not necessarily directed, but also involved with just, perhaps poor, oral motor skills as well.
Absolutely. So once you've done that full assessment and your intake of a client, you might decide, boy, they could really use some increased tongue strength, or they really are not coordinated with their sucking. We can work on that. So these are going to be activities that can apply to a variety of feeding situations, but certainly are applicable to babies that are coping with the tongue tie journey.
Oh, I'm excited now. I feel like my toolbox is going to be getting filled up. So, all right. So I'm going to put you to the test now because I really want to know a little bit more. We're going to dive a little bit deeper because I want to know a bit of an example or a case study that you might have where you've seen this actually be effective. What was the significant difference in an infant's feeding abilities after this?
Great. Well, I can think of so many cases, but I'll think about one that just happened recently where I saw a baby, maybe around 6 to 8 weeks of age, and they had already had a frenectomy. Release was great. They were healing great, but the parent was still complaining that there was a lot of clicking, a lot of air intake, and so therefore a lot of related digestive issues. Now the baby had a more mobile tongue post-release, but they weren't cupping well. They weren't strong.
Mm.
And so they were getting in a lot of air and it was causing some digestive upset. So by implementing some fun play-based things to work on their cupping, their seal, their strength, that really helped them get less air in, and it really helped their tummy comfort improve.
Oh, well, that's good. Yeah, I guess we don't have a lot of time today to take a big dive, but that just shows the significance quickly there, how that could improve a case scenario. So that's absolutely fantastic. All right, thinking about parents now, I mean, parents and care providers, they really have a lot to face these days when it comes to these challenges. My heart, my empathic heart is just always with them as they're dealing with some of these things. But tell me, what can they do, or, how does this presentation really help them address some of the concerns?
Yeah, I think one way it helps address some concerns is that many parents and even many clinicians think that just doing a frenectomy will solve the problem.
Right.
Problems. And so I think, we have a wonderful multidisciplinary lens through this symposium where we're seeing all the types of assessment, optimal timing, aftercare, but we still need to realize, that the release itself doesn't fix every problem. And so sometimes we need to be helping a family develop their child's oral skills, facial development, strengthening things that need to be strengthened, toning down things that are too tight. So the piece of the puzzle is that often the frenectomy is one part of the puzzle, but that these babies often need some accompanying supportive strategies to really get a little closer to their goals.
Boy, there's so much detail and, discussion in kind of all these conversations, because of course, every family really is so unique, when we're addressing some of these things. So, a lot of empathic skills, counseling, that must play a significant role in this too.
Yeah, I mean, we can't just be doing things to babies to do them. We really have to always be bringing our therapeutic presence, be really communicating with the family, the caregiver, and the baby, seeing what's going to work for them, what's sustainable, what they're enjoying, what they're not enjoying. And it does take a team. And I think honing our therapeutic skills and communication skills is just as important as the clinical activities.
Right.
Working with somebody. Absolutely.
Yeah. So tell me then, are there any drawbacks to this? Like, when we're working with clients, could this actually be too much? Could it be overwhelming for all parties involved? Like now I'm thinking about everyone's mental health and all its part. Yeah. So what happens then?
That's a great question. Are there drawbacks? I think that it's, the onus is on the clinician to figure out what particular activities does the child need. And for us to remember, especially with babies, less is often more. So when I'm talking about some kind of care plan, no baby out there is getting some 20-minute oral functional activity workout that has, 29 bullet points. It's often 1 to maybe 3 basic activities, reevaluating a week, seeing what we need to layer on. So I think that the drawback can be sometimes we think, oh, this is good, so more might be better, but having a balanced approach where we're having balanced frequency, personalized activities specific for this child, and being mindful to see, are the activities we're having them do, is progress happening, or are we still just plateauing? We always want to see forward moving progress to know that what we're implementing is the right thing. So keeping it simple is a big take home message from this presentation.
Right.
These basic activities are quite powerful.
Oh, wow. Oh, gosh. I feel like I just had a little mini presentation right there. Melissa, thank you so much. Little inside scoop there. And, there's so much to be learned in, this whole area. And I feel like you communicate so well. I know how passionate you are about doing this and offering up your skills and many videos. I just want to let folks know there's many examples, real life, watching babies go through this process with their families. So thank you so much for not only sharing today, but for those of you listening in, you're in for a real treat in this presentation as well. So thank you, Melissa.
Thank you, Fiona.
And I do want to let everybody know, as we're here with Melissa Cole, Melissa, you joined our team this year as part of our Gold Lactation Chair for 2024. So some more surprises and more content coming around. Melissa's actually going to be overseeing it this year. So look forward to our next year Gold Lactation online conference as well.
Yeah, it's a pleasure to be in front and behind the scenes at different times, and working with Gold is always a treat. Thank you.
Yeah, thank you. Well, for those of you here today, I know we've been focusing on our Tongue Tie Symposium, so be sure to head over to the website right now to goldlearning.com. There you're going to find all the content coming up as part of this symposium. I did mention that it is 2 days. It will be fully recorded, but of course, we love to have you come live to these presentations, 10 presentations in total. So it really is top-notch tier education for all of you to take back immediately into your clients' homes and clinics and hospitals. It'll be really important that you stay up to date for all of this content. Well, thank you again to Melissa for joining us here today, and we will look forward to seeing all of you online. Bye-bye for now, everyone.